and I'm going to demonstrate the physical assessment on how to perform it. First, I'm taking the health history. Start your assessment by taking the detailed health history to obtain subjective data. The information you gathered during the interview, you will provide insight into the patient's actual or potential health problem and guide your physical assessment. While the patient changing his gown, first we need to wash our hand, and second, assemble all equipment. We have stethoscope, thermometer, pen light, otoscope, and the BP apparatus. In physical assessment, we need to know the basic technique. We have our observation, palpation, percussion, and auscultation. To make the patient feel comfortable and respected, begin with open-ended question. Requires yes or no answer. Ma'am, do you smoke?
No.
Also, note the patient's level of unconsciousness, including his degree of wakefulness and orientation to persons, place, and time. First, taking the vital sign, we need to get his temperature, peripheral pulse with radial part with with 2 or 3 finger in 1 full minute. Going to take his blood pressure. Don't tarang. After obtaining a health history, ask the patient to his bladder and provide his urine specimen of if needed, and then to completely and put on the gown. First, we're going to assess the patient's head and face and inspect the heads and face. They should be normal in size, shape, symmetry, and contour.
Go.
Look at the patient's hair and note distributions, quantity, texture, and color. The hair should be extremely dry or oily and should not contain scale and meat. Next, palpate. Dalawa akong skull, which should be pink, mobile, and free of lesions. You may feel bony prominence in the forehead and in the side of the parietal bone and behind of the ear, and there are normal. Using the tip of your middle and an index finger, palpate the temporal artery. The pulsation should be feel equal.
Go.
Listen for you easy over the temporal arteries. You should not hear any. Rest your thumb under the inner aspect to the to palpate the frontal sinus. And press under the zygomatic bone to palpate the maxillary sinus. Then lightly discuss the area of palpating and precautions. The sinuses should not cause pain or tenderness if they further with transpilation. Finger to the patient's temporomandibular joint as you palpate with your middle finger. Instruct the patient to open and close his mouth to open and close mouth. The joint should be freely and painless, and to test facial muscle and to motor pressure to the facial trigeminal nerve. Have the pattern raised and knew his eyebrow. Bare his teeth. Smile broadly. Tap out his cheek.
Go.
And keep his mouth closed as you try to open, and of those movements should be symmetrical. Patients reported pattern with his sense of taste during the health. Patients reported pattern with his sense of taste during the health history interview. Test the sensory portion of the facial sense by having him
Go.
identify sweet, sour, bitter, and salty substance salt to assess the portion of the trigeminal nerve. The patient ability to identify simple touch. Instruct her to close his eyes
Go.
and to tell you the moment they feel something touching his skin. Check for a simple touch sensation both side of the pattern, forehead, cheek, and jaw. The patient should feel the sensation equally on either side of his face.
Left head, right head, left cheek, right cheek, jaw.